Lifting the White Walker's Curse. Management of Coats disease. George Coats was the first to describe this condition in 1908 as a retinal vascular abnormality with exudation occurring in male children or young adults. 95 to 100% of these cases have an unilateral presentation with an incidence of 0.09 in 100,000 of population. Patients can present with an array of findings including leukocoria, vision loss, strabismus, nystagmus, pain. Visual acuity can vary from 20/20 to no perception of light. Pathogenesis is explained as breakdown of blood-retinal barrier due to the changes at the endothelial level of the retinal vasculature with the presence of abnormal pericytes, which, along with the damaged endothelium, causes bulging of the vessels and the characteristic telangiectasia. The damaged vasculature often rests in a bed of relative retinal ischemia. Exudation of lipids from these vessels is responsible for retinal detachment, retinal thickening, and retinal cyst formation. Shields et al. Describe the clinical features, natural cause, classification, and complications of Coats disease. Coats disease is less common amongst adults. Adult-onset Coats disease phenotypically differs from its counterpart in children, that it is less symptomatic, may have good visual acuity, limited area of retinal involvement, and slower progression. Coats disease in adults often doesn't need surgical intervention, can be managed by laser or with cryotherapy. However, in children, the presentation is severe, often requiring surgical intervention. We present to you our encounter with the White Walker's Curse. A 2-year-old boy was brought by his parents with complaints of whitish reflex in his left eye since 2 months. Anterior segment examination was within normal limits. Fundus examination showed stage 3B of Coats disease with exudative retinal detachment. Standard treatment for such cases involves external drainage of the subretinal fluid. Hence, we started with conjunctival peritomy. Thereafter, isolation of all 4 recti muscles. External drainage was done from the inferotemporal quadrant, 7 mm behind the limbus with 24-gauge trocar. External drainage at times can be incomplete, leaving the job unfinished. Hence, the decision of vitrectomy was made. After core vitrectomy, PFCL was injected in order to shift subretinal fluid anteriorly, aiding in better external drainage. Complete subretinal fluid drainage helps in safer posterior vitreous detachment and effective cryotherapy. This was the fundus picture at first week, after 1 month and after 1 year. Currently, the child is undergoing visual rehabilitation. Conclusion: Coats disease is a dreadful condition with poor prognosis. Therefore, Early detection and timely surgical intervention is essential to avoid further complications in children.